This is Blake Kosmeyer. I'm about 6 days out from having my left AC joint restored, fixed. I had a grade 5 separation, and it happened during a bicycle accident. I went over the handlebars while I was going over a curb. I'm a competitive cyclist, and it's put me out for the season, but kind of doing this video series to document what to expect when you're going through a procedure like this. So yeah, I had my first post-op with the doctor today. They took off the dressing. I love that term because it makes me think I had like a whole bunch of Thanksgiving turkey dressing just dumped on my shoulder. That's how it felt. It was like gross and soggy. So that's gone, which feels awesome. They took the stitches out, which was kind of interesting. They did one single stitch throughout the whole thing. They just clipped off the ends and pulled the threading through. Actually not as painful as you'd think. So as far as my pain goes, personally, it's pretty mild right now. Unless I do something and move this in a weird way, it doesn't really hurt. It gets sore after a while. I'm a writer, so I've still been writing, kind of typing with my hands up like this. And so sometimes when I do that, it'll just get kind of achy after a while. So give yourself some rest. I'm completely off all of the Norco and all the hardcore pain meds. I'm just on ibuprofen now. So yeah, the wound itself is kind of weird. You can see it's still like there's still a bit of a bump there as opposed to my other shoulder. But that's a lot of the swelling that's built up underneath the incision that should go away over the next 6 weeks. The space itself is kind of weird. I have some numbness right around here. Not super bad, but it's noticeable. It's like just not as sensitive as the other parts of the skin, so maybe some minor nerve damage. All of it, of course, is a huge benefit to the situation I had before. The surgeon said that when he got in there, that the ligaments were 100% severed, and that it wasn't going to, there's no way it was going to grow back on its own. So it was a really good thing that we had the surgery when we did, which was reassuring to hear, because obviously it was I guess it was a stage 5, but he'd given me an option to not have surgery. So if you're on the fence, my personal experience has been awesome. So just putting it out there. I'll be able to shower tonight, which is huge. I haven't been able to shower in, I guess, just about 6 days, but it's weird how much that changes things. Also should be able to sleep a lot better without having that ugly, gnarly dressing up there. The doctor cleared me to start exercising again, which for me is a huge peace of mind. It just kind of helps me in my life. I'm a cyclist, so obviously nothing with any kind of running. I can't move my hand at all, but he said I have 2 other slings that have a band that wraps around like this. He said I can use those on the stationary trainer from the bike, or while I'm doing other kind of things that don't at all involve this shoulder. So that's really good. It's exciting for me. So this is the gauze sling that he made for me to shower with. So this goes over my head, and then I just put my hand through it, and it takes the weight off of this shoulder when I shower, or anytime I'm not wearing this sling. I used something like that initially when I first had the injury, and it's super easy to do. You can do it with a t-shirt or a towel, but basically just bind it up and basically make a little loop. You'll put it over your head, and then you can put your hand through it like that. And if it's too small or too large, you can wind it up like this, and it also kind of limits your range of motion. And as you can see, I mean, it basically works pretty well as a DIY sling in a pinch. So I'll be using this to shower with. Outside of that, I'm going back to work tomorrow, which is good. It's going to be good to be around people. I like my work environment, so I'm excited about that. And yeah, overall, first week has been a pretty positive experience, with the exception of some vomiting. So yeah, let me know if you have any questions or whatever, and I hope this has been useful to you. I'll be posting again in a couple of weeks, probably after I have an X-ray and start seeing a specialist, and when I start my rehab. Okay.